Well, thank you for having me. I'm Melissa Crist. I'm a core director at the University of Idaho's Center on Disabilities and Human Development, and I direct all of our early childhood projects. We're probably commonly known for the Idaho STARS project. It's a large project that provides all of the professional development and quality improvement support to childcare programs and providers in the state of Idaho. I also direct the Act Early Idaho project, which will be a direct connection to what I'm sharing today. And then we also support the state's Idaho School Readiness Project, and early identification activities are integrated in that work as well. So there's lots of intersections in the early childhood projects I direct at the center. Next slide, Lindsay. I mentioned the Act Early Idaho project, and when I was thinking about what to share today, I thought that I certainly had to share information around the Act Early initiative and my work as the CDC's Act Early ambassador to Idaho. Just sort of glancing at participants today, I see that we have Act Early Idaho team members participating, so you already know a little bit about the work that we do. For those of you that do not, Act Early is an initiative of the CDC, the Centers for Disease Control and Prevention. It was managed previously by the Association for University Centers on Disabilities. It is now managed by the American Academy of Pediatrics. So we're really excited about that new partnership and collaboration with the American Academy of Pediatrics. A few years ago, every state that had an Act Early ambassador received funding to do some COVID relief and recovery work related to early identification. And part of the requirements of that grant were to develop a state team doing Act Early or early identification work if that did not currently exist. And in Idaho, we did not have an Act Early team. So my co-lead, Dr. Noreen Walmack, and I developed the Act Early Idaho state team. It is a team of birth to 5 partners, all focused on early identification activities. Those activities range from developmental surveillance monitoring to screening, referral to early intervention, and then receipt of early intervention services. Next slide. All right, it was a little difficult to narrow down with the topic that was shared, sort of what content I could bring to your time today. And I decided to try to connect the dots on a few things that I knew I could share with you. So the presentation objectives are: 1, to understand the difference between developmental surveillance and developmental screening as initial steps in the early identification process. This is something I've been working on a lot with state partners. We conducted a needs assessment with the CDC, and we learned that commonly developmental surveillance or monitoring and screening are confused. And in Idaho specifically, we saw that we had a lot of systemic support and processes for implementing screening, but not so much surveillance and monitoring. So the work I've been doing and continuing to do is to build knowledge of what is surveillance or monitoring, and how does that connect to screening. And then, of course, when we're talking about surveillance or monitoring, I introduce the resources available through the Learn the Signs Act Early initiative, which are the tools to conduct surveillance in healthcare and other settings. Those tools, the sort of heart of those tools are the developmental monitoring checklists that contain developmental milestones. Some of you, I'm sure, are familiar with those resources, but maybe did not know that in 2022, the milestones went under an extensive revision that was conducted by the American Academy of Pediatrics. So I wanted to just, if you hadn't heard about that, just clarify the purpose in that process. There is a lot more to that, and I can direct you to the article if you're interested to learn more about that. And then lastly, sort of connect all those dots around early identification, those first steps, to then what early intervention and early childhood programming options exist for children with autism spectrum disorder in Idaho. So with that, if there's anything you would like me to touch on that isn't sort of in those objectives, I'd say throw it in the chat. I'll try to take a glance and integrate it if I can, or I'd also be happy to follow up at a later time if you have a specific topic you'd like to connect with me on. So starting with developmental surveillance and screening and the differences, I always start with the why. Why are we talking about this? Why is it important? And I'm sure many of you know this, but 1 in 6 children, that's the age range of 3 to 17 years, has a developmental disability. So when I'm talking to early childhood programs, especially around why they should engage in this work, I say you're serving these children. These children are already in your programs, right? So a big role we have in the first 5 years, and a big priority is that we recognize that identification of developmental delays and disability is part of our work with young children, because we are serving those children that have not been diagnosed with a developmental delay or disability. The prevalence rate of autism, of course, continues to increase with a current prevalence of 1 in 36. And we know that in the earliest years, and especially for children that are low income, it's more common to experience developmental delay, 1 in 5 children. So that's really the why behind prioritize this work, focusing on each of these steps of early identification, including developmental surveillance or monitoring. All right, next slide, and I'm seeing a chat there. Yeah, and DD services, yes. I don't know that I'll be able to touch on that one, and that one is a really complex one, but I'm happy to follow up on that later. So to clarify the difference between surveillance and screening, and again, when we conducted the needs assessment, we saw that there was a lot of confusion around this. It's important to note the simple way to explain it. I say surveillance is ongoing, and informal screening is done at specific times. There's a specific recommended schedule, or anytime there's a concern, and is more formal. Surveillance also directly engages families, and this is so important. I usually always say family engaged surveillance or family engaged monitoring, because it is absolutely essential that families be an active participant of that surveillance or monitoring. There are no scores or risk categories from developmental surveillance, and it can support screening. And I find that it often does directly support screening, so much so that I always recommend it at a starting point, especially for partners that are not conducting screening. What I found, especially with families engaged in surveillance, is that when they understand development, when they have the tools to sort of examine that for their child, they're better able to complete screeners. They've been thinking about development. They're a little bit more knowledgeable when they get handed that screening tool on what they're seeing or not seeing. There are 6 specific components of surveillance. It's to elicit concerns, obtain developmental history, assess strengths and risks, to observe the child, document findings, and obtain and share results. And again, this is collaborative with families. So shifting to screening, I'm sure all of you know there's the recommended schedule for developmental screening, general development at 9, 18, and 30 months, and autism screening at 18 and 24 months. And then again, at any time there's a concern. So I think that's a really important connection with developmental surveillance or monitoring. It's oftentimes that regular monitoring can trigger a concern sort of outside of the regular developmental screening schedule that would then trigger a developmental screening be conducted. Screening is conducted with validated screening tools. I would say probably our most commonly used tool in Idaho across all early childhood serving programs is the Ages and Stages questionnaire. An Ages and Stages social emotional questionnaire. It does provide scores and risk categories. So this, of course, then is our trigger for developmental evaluation to determine eligibility for early intervention or early childhood special education. And I'm going to add the note there. One of the sort of connection pieces of this work across systems that I'm working to do, that if partners are increasing their screening activities and then doing those referrals, it's not necessarily necessary for a child to be re-screened. That screening with the ASQ, whether it happens with the child care program or the healthcare provider, can be used by early intervention or the early childhood special education program as evidence to go right to a developmental evaluation. And I think sometimes families get stuck and things get delayed because everyone's doing the same thing over and over again. So that's part of the systems work that we're working on, is not duplicating these activities when they are done with families. All right. So now I'm going to jump into how you can conduct developmental surveillance and how we are working with many, many birth to 5 serving programs to do this. Next slide. So this is the heart of the Learn the Signs Act Early Initiative, our developmental milestone checklist tools. You can utilize the app to monitor development. All the checklists are in the app. This is my favorite way to get the tools to families, because I think an app that sends you push notifications to complete a checklist or to learn about the development that is occurring at that age and ways you can support it is just easier. In the middle there, you see one of the checklists, the 15-month-old checklists. The checklists can be printed from the CDC Learn the Signs Act Early website, and you see the link down there. They are also available in an electronic format now, so that families and caregivers can complete the checklist and then have it emailed to anyone that might be interested, like the healthcare provider. And then there is the Milestone Moments booklet on the right, and that's one of my very favorite resources. I call it the developmental passport. I think it's especially helpful for infants, because really you can track all developmental milestones and more just with this one booklet. And so I know a lot of partners that serve infants get the booklet, the Milestone Moments booklet, in the hands of families right away as their tool to track and learn about development and address concerns. Next slide. In addition to the milestone tools, the app and the checklists and the booklet, there are many other resources. And again, these resources all are health communication tools to support developmental surveillance. They are also all free. Sometimes they can be hard to access though, so I'll share a little bit about how you can access them, but there's the growth chart, there's many posters. The ones at the top there with the milestones are utilized by a lot of WIC clinics to just introduce developmental milestones to families when they're spending time in the WIC clinic, which they do regularly. A favorite of partners is the 3 books. There's the Baby's Busy Day board book for the 1-year-olds, Where is Bear, the 2-year-old book, and Amazing Me, the 3-year-old book. Those are available in English and Spanish. Those books are fantastic to share with families because they encourage shared reading with their children, and they also introduce developmental milestones through the story of the character at that specific age. So all of these resources are available through the CDC. Most can be downloaded directly in electronic format. You can also order materials directly from the CDC. And I try to notify partners if they are using the materials when they have those in stock. I also try to make sure that I have funding to keep some in-house so that I can mail them directly and help partners access these resources. So I will also share a link if you can't get them directly through the CDC. You oftentimes can get those directly through Act Early Idaho. They can also all be branded. So a lot of providers choose to brand them with their own logo and additional information around their program. And so they really are developed for the use of everyone to really expand developmental surveillance and monitoring, however it works for them. Next slide. All right, so the benefits of using this specific initiative for surveillance and monitoring links back to the update of the milestones that I mentioned. They're evidence informed. So right now, after the revision of the milestones, all milestones are what most 75% of children or more are expected to achieve at that specific age. So the weight now is on whether a child is demonstrating the milestone or not. For those of you that are familiar with Learn the Signs Act Early, you might know that it started as a specific initiative for early identification of autism. It has evolved since then to be more broad developmental for very specific reasons. And it also included red flags. And what was learned initially is that there wasn't a lot of excitement around engaging families on monitoring red flags constantly with a concern about autism. But when the initiative was broadened to really educate about developmental milestones and how to address concerns, it got families more engaged. It became a more purposeful initiative and tool for surveillance of developmental concerns holistically. And so that is still a consideration and of course a priority for identification of autism early, but it's broader than that today as well. And you can see that in the resources. Yes, I like that it was retired as well, the term red flags. I think a lot of families were really concerned when they were given tools with milestones and red flags where they put the weight. Like they didn't know if the concern was around, well, are they meeting the milestones or not, or are they demonstrating red flags? And so I think the revision has really helped with that. And I agree. I think so often part of being a parent with a young child is getting to celebrate development, and that needs to be part of this as well, not just always looking for concerns. The intent really was to avoid wait and see. The previous milestones were generally more about what 50% of children or more would be doing. And that unintentionally created a lot of wait and see. The intent now with the revision is that we're not waiting to see, and that if a child is not demonstrating that milestone, then it's a concern and you move forward with developmental screening. The tools, this initiative meets the needs of families and professionals. It allows parents to be actively engaged and other family members and caregivers in monitoring development, understanding steps to take and who they partner with when there's a developmental concern. And it's also a tool for supporting healthcare professionals with developmental surveillance in collaboration with families. And the checklists now align with well child visits, which is really convenient. Next slide. Double check my time. I want to make sure we get enough time on programming. Here quickly is just additional features of the checklists after the revision. There are open-ended questions to address things that families might have concerns about or things they want to discuss. And again, that's perfect timing for well child visits, reviewing the milestones and any concerns that might have come up. Guidance for what to do when there is a developmental concern. Even the app directs family members directly to early intervention. So specifically infant toddler program, so our early intervention birth to 3 program. There are tips and activities for developmental promotion so that families can be thinking about ways they can support development. Reminders about well visits and developmental screening, ages at the recommended schedule, and then anticipatory guidance on what to expect at that next checklist. Next slide. Part of the revision was making sure that the resources were relatable and accessible. The level of language is at a 5th to 7th grade reading level, which can be really challenging, but they were able to do it. Milestones that are listed are all observable in natural settings. There was cognitive testing of the milestone done with families. A lot of diverse families and fathers were included as well. They are available in many languages. The CDC has done a formal translation of the materials into many languages. And I always say, if you have a language and you're trying to access that and you don't see it through the CDC, let me know, because it's likely another state has translated the resources and I can get access to that. And again, everything is free and accessible. Next slide. All right, really quick on the milestone revision. And I've touched on some of this already, but checklist for 15 and 30-month was included to align with well-child visits. They did not align previously. There was some language in the milestones previously that included may or begins. It was really vague. That was all eliminated to be really clear and direct on the milestones so parents could understand those. There are also aligned videos and photos of the milestone. That's another reason why I love the app, is those pop up with the checklist so that families can see those milestones in action. There are no longer warning signs or red flags. The revisions help to avoid common questions like how many milestones can be missed. We know if any are missed, it's a concern that warrants screening. And again, the weight is put on the milestones. And the whole purpose here and intent is to avoid wait and see. We know when we are doing both surveillance and monitoring with screening, we are identifying more children earlier. There's been some research studies that have shown evidence that both activities are essential for identifying children as early as possible, including those with autism spectrum disorder. Next slide. So quickly, the established criteria, as I shared, was specific to including milestones where most children, 75% or more, demonstrating that milestone. It was an extensive literature review. I think a lot was learned around the normative data we have on developmental milestones. I think for those interested in research on development, there were some ahas like, oh, we need a little more evidence around this, that I think has kind of pushed us to think more about the evidence we have in general around developmental milestones and what information or research needs to be conducted. The existing CDC milestones were all reviewed. They eliminated milestones without any evidence, and it's not listed here, but they also eliminated milestones from checklists that were repeated. So now milestones exist only on one checklist. There were a few that were repeated, and then they added milestones with evidence and expert agreement. And I mentioned that was just like a really quick, and you can go to the next slide. Thanks, Lindsay. Update on that revision. There was a lot to it. I have been asked a lot of questions about it. I direct everyone to the article from the AAP on that full revision process. And so there's the link there if you're interested. All right. Now, moving to from surveillance and screening to referral to early intervention and programming. When we talk about referral to early intervention, I already heard it in the short amount of discussion that I got to hear around the case study, but we generally are talking about Part C of the Individuals with Disabilities Education Act, which serves children birth to 3, or Part B, Section 619, that serves young children 3 to 5. In an academic setting, with those being the school districts as the lead education agencies. So one of the considerations when we came together as a state team to talk about early identification is that when we have developmental concerns that are validated from developmental surveillance and screening, and we're going to make a referral, who all does that go to? And what happens when there's still a developmental concern and the child is not found eligible for these specific programs, which does happen. And so while these are the early intervention and early childhood special education programs that we talk about generally being that next formal step for referral after concerns are identified, there are some other considerations for early childhood programming that we want to look at as well. Next slide. Back one. Head Start and Early Head Start is required to have 10% of their enrollment in every Head Start program for children with disabilities. So they do not have to meet the income requirement for Head Start if the child has a developmental delay or disability. Head Start also includes extensive disability support services. They have on staff a disability coordinator who can be a tremendous help to families and children to receive developmental support in an inclusive setting. There are also a lot of resources and support for Head Start educators on how to successfully support the development of children with developmental delays and disabilities, including autism. So I think we don't always think about referrals to Head Start for children with disabilities, but it is a priority for Head Start. And there are a lot of resources within Head Start to support children with disabilities. So it's an important program, and we actually developed a roadmap for families talking about where they go, who they're referred to, and we made sure that Head Start and Early Head Start was included, knowing that it can be such a support to families with a child with a developmental delay or disability, including children with autism. McV, our home visiting partners, are also fantastic resources for young children and families in terms of supporting development. And I also think they happen to be fantastic connectors and supports for accessing other resources. And so our state team really wanted to prioritize home visiting as another early childhood program that we're connecting children with disabilities to. And so in Idaho, we run a few different home visiting programs, primarily parents as teachers and nurse family partnerships. But that is another consideration for referral. Next slide. Childcare, and this is a direct sector I support in my work through Idaho Stars. I think we always have a lot of questions around childcare for children with disabilities, and I think we have some work to do on building understanding around how childcare can be engaged in early identification, which is something we're working on a lot, and how we can make sure that families that have a child with a disability get childcare and get connected to the right childcare that can meet their child's needs. One of the ways that we're supporting that for families in Idaho is through what we call enhanced childcare referrals through Idaho Stars. So if a family needs childcare, and a lot of families in Idaho need childcare, and their child has autism or another developmental disability, they can contact Idaho Stars and ask for an enhanced referral. And what the enhanced part means is that we will work directly and follow up with the family on the referral to programs, and even offer support directly to the program for successful inclusion of that child in the child care setting. So not a lot of, we do not get a lot of referral of enhanced referrals. So I've been really working on spreading the word that this is support that Idaho Stars can provide to expand access to child care settings for children with autism. And I saw we had an Idaho Stars approved trainer on today, but and she does a lot of disability specific training, but we provide training through Idaho Stars and through our network of approved trainers on disability specific topics, on autism, and then inclusive early childhood practices. Again, with childcare, our hope is to meet family and child needs, that we provide the right supports and professional development to make sure that children can be engaged in the childcare setting. And I will tell you, I do a state tour and visit childcare programs. I try to at least once a year. Children with autism are in childcare settings. They're there, and I think it's about what types of support and what types of connections we make to the childcare programs that allows those childcare placements to be successful and supportive of their development. Another initiative that we have in the state is called the Idaho Pyramid Model. If you're not familiar with the pyramid model, it's a tiered framework for supporting social emotional competencies of young children through the practices implemented by the caregivers, the teachers, starting at the base with environmental practices, all the way to the top to individualized direct behavior intervention and supports. And so this collaborative consists of Head Start programs, our school district, Part B, Section 619, or early childhood special ed partners, and childcare working together to implement the pyramid model to fidelity. And really what this is doing is allowing us to integrate more behavior specific interventions for children, which is probably the most frequent request we get for support from early childhood educators, but also too, it's expanding inclusive opportunities for children who are typically don't get in the door of some of those programs, or once they are expelled from those programs. So a lot of work happening there, and a lot of, I think, great collaboration in the state. Next slide. And lastly, I wanted to just touch on, this isn't an initiative I'm leading, but my work connects with it a lot. Idaho, through the Idaho School Readiness Project, has many early learning collaboratives working on birth to 5 systems building at a community level. If you are a provider in one of these communities and you have not heard about this early learning collaborative, I'd say it's the time to get connected and find out what they're doing, what the priorities are, how you can be engaged. I know an increasing priority is how those communities are serving young children with disabilities, including early identification and the intervention supports they get and what exists in those communities. If you'd like more information or contact for those early learning collaboratives, that's available on the Idaho AUIC Association for the Education for Young Children website. Next slide. All right, and I think I'm out of time. So really quickly, here's just some resources, and there's resources listed at the end of the presentation. These are some posters we've created that link to the roadmap, a training around how to navigate concerns for families. If you hadn't seen these trainings through the American Academy of Pediatrics, there's trainings on the milestones, conducting surveillance and screening, and then on autism, and there's my contact information. I don't know that I was able to touch on everything in the chat, but I'd be happy to connect with anyone that would be interested. And there's the resources there at the end.
Thank you so much, Melissa. What great information. I think we probably all underutilize Head Start and other early act resources. So great reminder. I think in the chat, and I don't know, Lindsay, if we want to address these and people that can stay and benefit from the answers, or if we want to stick to our time and be respectful of everybody.
I'm sorry, we better stick to our time.
Okay.
There are some questions, and I thank you, both Tom and Elena, for answering some of those.
Sorry.
Oh, sorry. Oh, Melissa, thank you so much. So what I'm hoping, if there are additional questions, if you can put those in the chat, we'll connect you with Melissa and get those questions answered. This was just fantastic. Thank you. As I mentioned, we are going to be transitioning to a new platform for our future Echo series starting in April. And so Laura is here to share information about what that looks like and the process for it. Before I turn it to Laura, I just wanted to let you know our next session will be April 11th from 12:30 to 1:45. So we are shortening our sessions starting in April. So they will be 1 hour and 15 minutes. So 12:30 to 1:45 Mountain Time. And the topic is understanding early social behavior development and the role of play in autism, presented by our panelist, Amy Francis. So we hope to see you on the 11th. And if you have about 5 minutes, hang on. I'm going to turn the floor over to Laura so she can share her screen and show you what this new platform looks like and help with that transition so that you are ready to go April 11th. Again, Tim, we adore you and thank you so much for all you've done. So, okay, thank you. Floor is yours, Laura.
Thanks, Lindsay. Hi, everyone. I'm Laura Jackson. Nice to see you all. As Lindsay mentioned, we'll be transitioning to our new platform here in April, and we're so excited. I'm going to share my screen real quick and just kind of give you a quick little overview. So if you come to our new platform, and you will see that there's a catalog here, and you can click on the catalog, and the autism program is within the catalog, and just click on that, and it will bring you to all the information about the sessions that we'll be offering. And if you scroll to the very bottom, you can, I'm not logged in right now, but Let me log in real quick so you can just see what that'll look like when you go to register. You have a choice. You can either click on the top here on Echo Autism and register for all of the sessions. And I apologize, I'm already registered for these. Or you can go down the side and click the specific topics that you'd like to register for and scroll to the bottom. And there will be a register button down here. So anyway, we're super excited and look forward to joining you there.
Awesome. So please send your questions as you're navigating that system. Hongyan, can you put a link again for the document that helps feed people through that process? Elsa, you had a question about what will happen to the old session recordings. So as always, on our YouTube channel, we have the didactic portion that is available for the public, and that continues. For our cohort, we'll have a different process for recording those session materials, and I can get that information specific to you. My question, I don't know, we'll have to think about it for cohort 1 versus cohort 2. So that's a good question, Elsa, and I'll have to get back to you on the access there for cohort 1. So I'm going to wrap us up. Sarah, thanks so much for the question. I think it's a question in here. Any other questions, we'll get back to the provider of that question and get the information from Melissa. So thank you so much. We wish you the best and see you in April. Thank you.